Welcome to this video on the neonatal period in pediatric nursing. We will focus on mastering newborn care and clinical assessment. Let's start with a foundational question. Which of the following correctly defines the neonatal period? The correct answer is B. The neonatal period covers the first 28 days of life, marking a crucial transition from intrauterine to extrauterine life. Next, let's test your knowledge on a key assessment tool. When should the APGAR score be assessed in a newborn? The correct answer is A. The APGAR assessment is routinely done at 1 minute for transition and 5 minutes for neurological stability. A 10-minute assessment is used if the score is initially low. Regarding APGAR scores, which score range indicates a newborn is in good condition? The correct answer is C. An APGAR score of 7 to 10 suggests a neonate is in good or excellent condition. Lower scores indicate the need for intervention or resuscitation. Moving on to thermoregulation. What is the most effective way to prevent hypothermia in a newborn? The correct answer is B. Kangaroo mother care, or KMC, which is skin-to-skin contact, is the most effective and natural way to maintain body temperature, promote bonding, and stabilize physiological parameters. Let's review vital signs. What is the normal respiration rate for a neonate? The correct answer is B. The normal respiratory rate for a newborn is between 30 and 60 breaths per minute. Tachypnea is when the rate is over 60 breaths per minute. Next, a question about common neonatal conditions. When does physiological jaundice typically appear? The correct answer is B. Physiological jaundice typically appears between 2 to 3 days, peaks between 3 to 5 days, and usually resolves by 10 to 14 days. Jaundice within 24 hours is considered pathological. Finally, on reflexes. Which reflex is characterized by the baby making stepping movements when held upright? The correct answer is C. The stepping or walking reflex is a primitive reflex, where the infant makes stepping motions when their soles touch a flat surface. It disappears by 3 to 4 months of age. Let's test your understanding of prophylaxis. What is the standard vitamin K dose given to a newborn? The correct answer is A. Vitamin K1 is administered intramuscularly to prevent hemorrhagic disease. The dose is 0.5 milligrams for preterm infants and 1 milligram for term infants. Next, a question on newborn head assessment. What is the characteristic feature of caput succedaneum? The correct answer is A. Caput succedaneum is a collection of serosanguinous fluid that crosses the suture lines due to pressure on the scalp during birth. Cephalohematoma does not cross the suture lines. Which condition in newborns is associated with a bulging fontanelle? The correct answer is B. A bulging fontanelle typically indicates increased intracranial pressure, which may be caused by conditions like meningitis. A sunken fontanelle indicates dehydration. How many arteries and veins are in a normal umbilical cord? The correct answer is B. A normal umbilical cord contains 2 arteries carrying deoxygenated blood away from the fetus and 1 vein carrying oxygenated blood toward the fetus. Which reflex is also known as the fencer's position? The correct answer is B. The asymmetric tonic neck reflex, or ATNR, is characterized by the infant extending the arm and leg on the side the head is turned, resembling a fencer. The normal birth weight of an Indian newborn is approximately what range? The correct answer is B. The average Indian newborn birth weight is typically between 2.5 to 3.0 kilograms, with weights less than 2.5 kilograms classified as low birth weight. What is the priority in the immediate management of a neonate with meconium-stained amniotic fluid? The correct answer is B. If the infant is not vigorous, clearing the airway immediately upon delivery is the priority to prevent aspiration of meconium. Neonatal sepsis often presents with which nonspecific sign? The correct answer is B. Poor feeding and lethargy are nonspecific but common and critical early signs of neonatal sepsis, requiring prompt evaluation. Which test is mandatory for screening neonates for congenital hypothyroidism? The correct answer is B. Congenital hypothyroidism screening involves testing for TSH levels. Early detection and treatment prevent irreversible brain damage. Let's look at a skin-related question. What is the vernix caseosa? The correct answer is B. Vernix caseosa is a protective, cheesy, white substance covering the fetus in utero, protecting the skin from amniotic fluid. What is the primary risk of hyperbilirubinemia in newborns? The correct answer is B. High unconjugated bilirubin levels can cause kernicterus, which is permanent neurological damage. When should umbilical cord separation typically occur? The correct answer is B. The umbilical cord usually dries and falls off within 5 to 15 days of birth. Delay beyond 3 to 4 weeks may need evaluation. What is the rooting reflex? The correct answer is A. The rooting reflex causes the baby to turn toward a tactile stimulus on the cheek, aiding in finding the source of feeding. Which vitamin is specifically needed to prevent bleeding in newborns? The correct answer is C. Newborns are born with low levels of vitamin K, which is essential for clotting factors. Prophylaxis prevents hemorrhagic disease. What characterizes physiological weight loss in neonates? The correct answer is B. Infants normally lose 5 to 10% of their body weight in the first few days due to fluid loss and meconium, typically regained by day 10.